Chapter 21, Lymphatic and Immune Systems, Part 2. So, moving on to the secondary lymphatic organs and tissues. This includes the lymph nodes. There are thousands of lymph nodes in our body, all connected to lymphatic vessels to filter the lymph. There's the spleen. The spleen is our largest lymphatic organ. And then lymphatic nodules. Nodules are tissues in certain locations where we're likely to have pathogens invade. Examples include our tonsils. Tonsils are lymphatic nodules. And then many of our organs that are primed for being invaded by pathogens have lymphatic tissue within the organ itself. So lymph nodes, here's a lovely little lymph node. As you can see, they are connected to the lymphatic vessels. They are a massive lymphatic tissue surrounded by a hard, dense capsule. And they are a large number of them in areas like the mammary glands, the armpits, the neck, and the groin. But again, there are others scattered in other places throughout the body. Basically, fluid, the lymph, will be traveling through the lymph vessels. They'll go into the lymph node where they'll be filtered and screened, and then they will exit through other lymphatic vessels. So afferent lymphatic vessels arrive with the fluid, it goes through the lymph node, and efferent vessels transport it out. And the lymph nodes will filter that fluid. They will trap and eliminate foreign pathogens. They'll get rid of cellular debris, basically anything that's cluttering it up. There are many lymphocytes and macrophages found in the lymph nodes, attached to that mesh inside the lymph nodes. And they are there to screen for specific pathogens so that they can initiate a specific immune response should a pathogen have invaded into our body. And the lymph fluid, as it travels through the vessels, gets filtered multiple times, filtered and screened multiple times, travels through many lymph nodes. Spleen, here is the spleen. It's in our upper left corner of our abdominal cavity. This is where the stomach would be, so the spleen is kind of squished by the stomach. And it is the largest lymphatic organ. Spleen has two kinds of tissues. It has the white pulp, which is lighter in color. The white pulp screens the blood for pathogens. That's the part of the spleen that is looking at blood, specifically blood, and has many macrophages, lymphocytes, etc., screening for pathogens to then initiate an immune response. Of course, we don't want pathogens in our bloodstream, but we do need to be able to be aware when they do actually make it to the bloodstream. And then the red pulp, the redder tissue in the spleen, that is there to remove aged, unfunctional red blood cells and platelets. So the red pulp is pulling out red blood cells that no longer function, pulling out platelets that no longer function. Also in the red pulp are areas where platelets are stored so that if we ever have a significant amount of blood loss, these extra platelets can be released into the bloodstream to try to prevent us from bleeding out. Again, over here, there is the spleen, there's the pancreas, there's the stomach, so the spleen gets squished by the stomach. All right, lymphatic nodules are clumps of lymphatic tissue found in certain areas, specifically areas that are common sites of invasion. So we have in the appendix groups of lymphatic nodules. We have around areas of the small intestine groups of lymphatic nodules referred to as the aggregated lymphatic nodules. And then in the throat are the 5 tonsils, the pharyngeal tonsil, the parapalatine tonsils, and the paralingual tonsils. So lymphatic nodules possess lymphocytes, B cells, T cells, as well as macrophages. They're screening for pathogens and hoping to prevent them from getting deeper in the body, prevent the infection before it actually gets started. And through this process, they can stimulate a specific immune response for that specific single pathogen. Some disorders. A ruptured spleen. Apparently, spleens can be damaged should you get hit in the upper left area of your abdomen. This can cause hemorrhaging, lead to shock, and if necessary, if it's damaged severe enough, lead to a splenectomy, removal of the spleen, which then would have the person's immune response be somewhat reduced. Tonsillitis. Tonsillitis is when your tonsils become inflamed and swollen frequently. It could be from a persistent infection, sort of inflammation that just keeps reoccurring enough that they feel the best thing to do is to remove the tonsils. And this is obviously treated by tonsillectomy. And as far as we know, there's no adverse effect to the immune response. AIDS is a collapse of the immune response, and it is triggered by the HIV virus. HIV. This virus targets helper T cells. So the HIV virus binds to helper T cells and then infects and takes them over, causing the helper T cells to stop functioning as helper T cells and instead make lots and lots of copies of HIV. And this leads to a collapse of the immune system. And that is what AIDS is. AIDS is the collapse of the immune system. And then the person is going to get lots and lots of infections, including what are called opportunistic infections. These are infections, illnesses caused by microbes that do not normally cause problems. So they're opportunistic. They're taking advantage of the weaker immune response to go from being benign to becoming a serious threat. So HIV infection has three main stages. You have the acute stage. Shortly after the person becomes infected, they'll develop some flu-like symptoms. Flu-like symptoms is our general response to a lot of different kinds of infections. Then there's the asymptomatic stage, lasts for years, where the person does not know they are infected. There is no obvious symptoms, but slowly over this time period, HIV is infecting and destroying helper T cells. And then eventually the helper T cells level will get so low that their immune response will collapse. When they get that collapse of the immune response, they now officially have AIDS. Nowadays, people take a series of medications and sort of a drug cocktail that helps to suppress the HIV. Doesn't cure them, but it turns it into a lifelong chronic health issue rather than something that will kill them. How to avoid getting infected with HIV? Well, avoid unsafe sex, through abstinence or monogamy, or condom use, another way to prevent getting infected by HIV. And there's a new drug, Truvada, I think it's also called something else like PrEP, that will prevent HIV from actually latching onto the helper T cells. Nothing's 100% except for abstinence. Intravenous drug use, again, that can lead to getting infected with HIV. One way to get around that is people who are addicted could be given clean syringes to use regularly to prevent spread by sharing needles. Blood transfusions can lead to an infection. However, we now screen all donated blood for HIV, so getting infected that way is extremely rare. Not impossible, but extremely rare. And also, a mother who's infected with HIV could give that infection to the infant during childbirth. So the way they try to avoid that is, one, by treating the mother so that if the HIV levels are low in her, it's less likely to spread to the infant. Cesarean sections are thought to help prevent the spread of HIV into the infant. Often they give the infant the same medications for treating HIV just in case, hoping that that'll knock out the HIV before it manages to establish itself. And then they also recommend that there's no breastfeeding or pre-chewing of the infant's food by the mother or anyone who has an HIV infection. Not really sure if that will spread it to the child, but they're just trying to be careful. All right, and that is it for this lecture.